A very good afternoon, everybody. I'm Priyanjali, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on dry skin. Dry skin, one of the most common skin health with focus on dry skin. One of the most common skin concerns, especially during weather changes. Do you feel like your skin gets rough, tight, or flaky? Many people think dry skin is just about not applying moisturizer, but it's actually a sign of your skin barrier needs help. Ladies and gentlemen, boys and girls, get ready for an insightful and power packed session. Today, we are delighted to welcome India's renowned dermatologist, Dr. Siddhi Tiwari, MD, DNB. She is the founder of Remedy Skin, Hair and Aesthetic Clinic Mumbai and a trusted expert in advanced skin and hair care. Dr. Tiwari has over 10 years of experience in uh, 10 years of clinical experience in dermatology, hair care, and aesthetic medicine. And she is a trainer for many younger generation and dermatological practices. And we would like to welcome her to today's screen. A warm welcome to you, Doctor. It's a pleasure to have you today. And today we are going to discuss on a very important topic, which is dry skin. And the first question would be for you is what exactly is this dry skin that we're talking about?
Hello, everyone. Hi. Thank you for the kind welcome. So, yes, we chose such a good and a very relevant topic right now, also looking at this season, which is dry skin. And let me tell you about the first question that you asked, that what causes dry skin, right?
Right.
Yes. So, dry skin causes could be categorized into, external causes and internal causes. In external causes, it's usually the modifiable causes. It could be right from your climate or environmental conditions, like cold weather, different, going to a colder place, dry weather, humidity, low humidity. Also, then it could be exposure to harsh soaps, harsh detergents, washing the skin way too frequently, or using extremes of temperatures like extremely hot water bath or a very cold water bath. So, extremes of temperature, humidity, and altitude changes. These are all the external causes. And when we come to the internal causes, which is from coming from inside the body. So, a lot of people who have certain disorders like thyroid or kidney or liver related conditions may have dry skin. Some people genetically are prone to dry skin. Those individuals are the ones which are called categorized into atopic skin. So atopy is a condition which runs in families, which is
Right.
either related to the respiratory tract or to the eyes or to the skin. The allergies of these three systems and the atopic skin individuals are the ones who have an inherently dry skin. There are also some other disorders which are genetic disorders, specific skin disorders called as ichthyosis. So those individuals are known to have dry skin. There are some medications which are responsible for causing dry skin. So broadly, as I explained, external causes, which are the modifiable or the environmental causes, and internal causes, which could be genetic, which could be any metabolic disease or some drugs, which gives rise to dry skin.
Right, right. Now, doctor, when it comes to any sort of skin condition, identifying the condition becomes a big deal. So,
Correct.
speaking about dry skin here, how do we identify the condition in the initial stage? As we know that cure in the initial stage is much more easier. So, how does it look in the initial stage?
Okay, so the symptoms, most of the patients, they themselves, they notice it. And when they come to the OPD, they do say that my skin is feeling very dry. So when they would say that, I'm feeling very tight on my skin after a bath, after a face wash, it's feeling stretchy, I'm feeling dry, I can see some flakes on my skin, I can see cracks or fissures on my skin. These are the early signs and symptoms of dry skin. But if not looked into at a proper time, then the dry skin may worsen into something called as an eczema or xerotic eczema, wherein because of the dryness, they will start having redness, they will have itching, and then it becomes more severe. The symptoms are more severe. And at that moment, the dryness has led to a secondary disturbance in the form of a dry eczema.
Right. Now, moving ahead towards the next question and the most important question, doctor. How do we deal with the dry skin? So, most of us, we think that just a normal skincare would do all of it. But is it enough, or do we need to actually visit a dermatologist in such cases?
Yes, so you rightfully said many a times doing the moisturizer in the early stages or maybe in the preventive manner works well. Okay, so of course, prevention is
Mm,
something that we would always focus to preemptively tackle the problem. So, a lot of people who have dry skin, and when they visit me, I tell them that you
right.
guys have to use a moisturizer two times, at least 2 to 3 times in a day, especially after
Mm-hmm.
every shower or after every face wash. You guys have to moisturize your skin. More often than not, this works. This helps in cases
Mm-hmm.
of very early signs of dryness. But also then other things. So looking at
Right.
the modifiable causes as we discussed. So people need to be a little more cautious when there is a change in weather, when they are traveling to a place where it's sub-zero temperatures or it's very cold, if there is snow. So then they need to be a little more proactive and do their moisturizers better, better hydration. Then, secondly, when it has crossed the stage
Mm,
beyond which now it's causing severe symptoms, then of course, when they come to us, we do give them a very good medical grade
right.
moisturizers, which are usually ceramide containing good moisturizers. There are also nowadays a very good quality moisturizers which have some anti
Mm-hmm.
inflammatory agents which are inbuilt in the moisturizers. So we to as a level one, we try to manage it with better grade moisturizer and more intense moisturizing. If it goes beyond that, then of course there is a combination of certain medicated ingredients, mild cortisones, and oral medications that we include in the prescription.
Right. Now, right. Now, doctor, there is another issue in our society or amongst all the patient that we see is whenever we are talking about dry skin, people normally tend to focus on the face, not on the body. So, is it equally important to focus everywhere apart from the face, just the face? Because we tend to focus just on the physical, the appearance, which is directly, in front of people. So, is it important to focus on the entire body, or just moisturizing the face or focusing on the face is enough?
No, no, of course I agree. So, the entire body skin is usually neglected. I would use the term because everybody's only focusing on the
Yes.
face. But, even doing basics, as in after a shower, if everybody starts, on a slightly damp skin, starts using a moisturizer even on the body, 2 times a day is good enough.
Mm.
And trust me, it's not even related to this season. It should ideally be done all the months of the year. And
Right.
especially in individuals who have dry
Right.
skin. Also, see, I'll tell you one thing: as the age advances, the moisture
Mm-hmm.
retaining capacity of the skin goes down. So, of course, those who are now
Right.
advancing towards more elderly age should all the more focus on the body skin along with the face. Another neglected
Right.
aspect, let me discuss, is hands and feet. So, the skin of hands and feet. And it is exposed to so much of, washing of the hands, exposed to a lot of detergents, maybe women who are, involved more with household chores. Then, the vegetable cutting, the fruits cutting, then washing. So, all of these changes causes the stripping of the moisture, especially on the hands and the feet. So I do see a lot of cases of hand and feet dermatitis, wherein
Mm-hmm.
there is a lack of moisture on the hands and feet. So I do, in such susceptible individuals, tell them that after every hand wash, please start moisturizing your hands and feet as well. So of
Right.
course, face plus body plus hands and feet.
Right. Uh, Doctor, we were talking about shower earlier. Tell us, can showering for a longer period of time somehow lead to dry skin as well?
Yes, so absolutely correctly put. Showering for a longer period of time and also showering with extremes of temperature. So both of these
Mm,
reasons can give rise to or may increase the dryness in the skin. Also, a lot of
right.
people who have a habit of constantly splashing water on their face, and they feel that,
Mm,
I came back, I splashed water 8 to 10 times. They feel that they are splashing water on the face, and they would say that, doctor,
mm-hmm.
I didn't use a face wash. I just splashed my face with water. But
Right.
every time you do so without, putting the moisturizer back after the face wash, you're stripping away the
Mm,
natural, water, or you're damaging the skin barrier, I would put it. And it's also
right.
not a very correct practice. So every time when during my
Right.
consultations, I specifically discuss about the number of times a person should wash their face. Yes.
Right. Right. Now, let's talk a little basic here. Um, Now, showering, if we are talking about it, what is the ideal time one should shower for every day? Secondly, we know there are specific religions where you need to, wash number of times a day. uh,
Right.
it is there in the religion. So what about
Right.
them? If they are watching the live, they might be wondering that we need to wash our entire self at least 5 times a day. I have also seen people after washing their face and their hands, they don't tap dry, or they don't dry their body, they just leave it as it is, they just let the water dry by itself. So does that also lead to dry skin? So what are the basic practices which one should, you know uh, apply, or the things which one should avoid on a regular basis?
Okay, so regarding the timing of the bath or the shower, I would
Hmm.
say
Hmm.
lukewarm water, and if you have 5 to 10 minutes to max 15 minutes, okay, but 5 to 10 minutes
Right.
average is a good time. Okay,
Hmm.
using an appropriate choice of cleanser or body wash, again depending on the
Hmm.
skin type. So the extremely dry, sensitive, or you remember I told you about the atopic skin. These people should use ideally a pH friendly or a skin pH friendly body wash or a soap. These are called as Sendet bars. So they match the pH of the skin. So of course, the sensitive skin types should be a little more careful and use a body wash or a soap prescribed by the doctors. But generally, people who have normal to a combination skin can go ahead with any gentle cleanser, 5 to 10 minutes, lukewarm water. Now, after the shower, the question which you asked, that should we allow it to naturally air dry, that is still okay. But the problem is when
Right.
people rub the water off too hard or try to keep it like squeaky dry. That's the problem. Okay, so that needs to be addressed. Don't wipe or
Hmm.
rub the skin in order to dry the water off. Rather, gently dab dry, or it's okay if it is air dry, very frankly. Now, coming to the third part of your question, which was people in certain religions when they need to wash the face or the skin for more number of times, I would say it's okay. But then every time you do so, then you make sure that you moisturize your skin as well.
Right. डॉक्टर, वी नो दैट हम जैसे खाते हैं हम वैसा दिखते हैं. So
Right.
does diet also plays a very important role when we're talking about dry skin? If yes, what sort of diet one should follow?
So, very frankly, hydration, or you would say the water intake and dry skin, is not a very direct correlation. I mean, I would not say that the dry skin individual, if just is consuming enough water, will not need other measures. It's incorrect to say so. So, good hydration is good for your overall health and well being, not particularly for the skin hydration levels. You need to use a moisturizer separately. But please go ahead, do fulfill your water requirements if you generally want to be overall, healthy. Regarding the
Mm-hmm.
food, very frankly, not so much of a role in hydration. But yes,
Mm.
omega containing supplements is something, or there are these ceramide containing oral supplements, not the drugs, but the supplements, which is something which I do or which we as dermats do prescribe in cases of extreme dry skin conditions. But the game changer is a topical moisturizer in most of the cases.
Right, right. Now, there is another major thing when we are talking about dry skin is regular use of makeup. We know people from certain industry who has to use makeup on a regular basis, irrespective of the gender. And we normally tend to see their skin, it's comparatively drier because of the usage of the regular usage of makeup. So what is the ideal way of using makeup if one has to use it every day?
So, very frankly, it's quite simple. You do follow
Mm.
your routine steps before you put the makeup. So,
Right.
using an appropriate cleanser or a gentle cleanser, then those
Hmm.
people who are using any active, second would be using an active. Very dry
Hmm.
skin individual can add a hyaluronic acid serum, then seal it
Hmm.
with a moisturizer, again appropriate for the skin
Hmm.
type. Then you do your sunscreen and then you do your makeup. So
Right.
if you directly have washed your face and now you're directly putting the makeup, of course wrong. Do your necessary skincare steps and do the makeup. Very frankly, there are good quality makeups now available. There are makeup which are fortified with moisturizing ingredients, hyaluronic acid, and all of that. I don't think it is that big a challenge. Another important aspect is removing the makeup and then again doing your steps after removing the
Hmm.
makeup. So
Hmm.
once you clean your makeup, double cleanse. So use either a cleansing balm or a micellar water first to clean your makeup thoroughly if you've put like heavy makeup, and then you go ahead with your face wash. After doing so, do your hyaluronic acid serum, do your moisturizer. So in this way, you have like managed to restore the skin barrier.
Right, right. Now, coming to the main point here, people who are suffering from dry skin and they are helpless of what to do, how to deal with this. What are the treatments available to treat dry skin currently?
So in these scenarios, these individuals should not try to treat it at home or do home remedies. If it is a recurring problem and if it is symptomatic and if it is affecting their quality of life or giving them any
Mm.
eczema, then these individuals should definitely consult a dermatologist because they will need a medical grade or a prescriptional cream and oral medicines. Okay. So when such individuals, especially these are individuals who are atopic or have eczemas or maybe psoriasis related dry skin, then there are a group of topical medications. The topical creams could be in the form of cortisones to control the inflammation. Then we have good quality moisturizers. We have moisturizers with soothing agents, specific ones, medical grade, which we as dermats we prescribe. We do help them with oral medications like antihistamines in case they experience a lot of itching because of it. I did mention some oral supplements which help, like in the form of omega and ceramosite containing oral supplements. And then, of course, if it is very severe, and then there are certain oral drugs, totally is a very case based and a very individualistic scenario. I would just like to
Mm.
advise the audience that if you are suffering from intractable dryness, you have done your bit, tried all good moisturizers, and still if it is not coming under control, it's time to meet your dermatologist. They may help you with better, more specific products. Also, they can help you probe the cause. So, as we discussed, if somebody has hypothyroidism, they may be on certain medications which is causing dryness. They may have that
Mm.
genetic nature of dry skin conditions. So, only a dermatologist is well versed to identify, diagnose these problems, and then treat you appropriately and more specifically.
Right. So, for all the people who are watching this live, this is one advice for all of you that please do not treat your condition by yourself. Make sure you visit your nearest expert. Doctor, it was a wonderful session with you today. We would like to thank you wholeheartedly for your time. Before we take a leave, any take home message for our viewers who has watched us so far?
Um, okay, so I would say that nowadays audience is also very knowledgeable. They are very well aware of what's available, what should they do, and I
Hmm.
appreciate the fact that people are becoming more careful or more aware of doing skincare. So very happy about that as a dermatologist.
Right, right,
But again, the last message that I sent, if there's anything that you're doing at your level and it's not helping you, or rather it's worsening your condition, I think it's time that you should discuss it or consult with your doctor. And I would
hmm,
encourage everyone to look after their skin and at least do the basics, at least do a skin appropriate and a weather appropriate cleanser, moisturizer, and sunscreen. If you guys are doing these three, most of your concerns would be under control. Anything specific which comes over and above, we are there to help you.
right. Right. Well, that was the expert advice for today, and that was Dr. Siddhi Tiwari for us. Thank you so much once again, doctor,
Thank
for
you
your
so
valuable time.
much.
It has been
Thank
a very informative session for our viewers today, and I'm sure they will use this information to prevent themselves and their near and dear ones from getting dry skin. And in case if they get to see such symptoms, they now know that instead of self medication, it's always better to approach a nearby dermatologist. It was great to hear from you, and we look forward to many more such sessions in coming time with our viewers. And also, thank you, viewers, for your excellent participation in today's session. To get latest updates on how to keep your skin healthy, do like and follow our Facebook page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. You all stay safe and stay healthy. Thank you.
thank you so much. Thanks.